We made some pretty public mistakes and we need to own them.
The Centers for Disease Control and Prevention once had a reputation for excellence. COVID blew that up. So now, following an external review of its handling of the virus, Dr. Walensky has called for sweeping changes. This following month after month of
tell the truth, follow the scientists and the science.
Fox News points out that footage of President Biden coughing and shaking hands with lawmakers went viral this week because CDC guidance advises that those with COVID, such as the president, mask up for 10 days. Mr. Biden, of course, can be forgiven. By its own admission, the CDC's response to COVID-19 has been confusing and overwhelming, with much of the confusion surrounding mask requirements, COVID tests, and vaccinations.
Those policies shut down the state of Michigan for longer than any other state. We had restaurants closed down for 8 months.
So what will sweeping change look like? CDC Director Rochelle Walensky says she's going to reshuffle the bureaucratic deck with an emphasis on action and equity.
The CDC can restructure all at once, but the leaders have just made a lot of bad decisions.
Make no mistake, the CDC, which has 11,000 employees and some 24 divisions, impeded a rapid and effective response to COVID-19. Not only did the CDC try to expand its power and reach, addressing social and environmental issues that are better left to the states or other agencies, it also failed in its core responsibility. That's to say, tracking diseases, collecting data to inform decision-making, and deploying resources to support public health at a local level.
Our government agencies weren't designed to manage a once-in-a-century crisis like this. And I think while many of them performed admirably, there is no question in my mind that these agencies could have done better.
Another big problem is that politics drives too many CDC decisions. That includes one last spring not to collect information on breakthrough COVID cases, lest it show declining vaccine efficacy. Then there was its school reopening guidance, which was written in part by American Federation of Teachers chief Randy Weingarten. And yes, while the CDC does now post more COVID data, often it's late and omits critical information. Instead of publishing raw data for outside scientists to analyze, the CDC often only releases studies that support their policies, such as mask mandates.
Is humility. I think they need to step back and get back into the advice game, not the mandate game.
Dr. Walensky now plans to make the agency more action-oriented. But the CDC's problem isn't inaction. Its problem is taking wrong and often counterproductive action, such as support for lockdowns and other government coercion. Her other proposed remedy is more spending. The agency received a 7% raise this year, but Dr. Walensky wants more for a new Office of Equity to increase workforce diversity and improve communications with minority groups.
There have been over 13,500 cases of monkeypox identified across 49 states, as well as Washington, D.C. and Puerto Rico.
Putting it bluntly, the CDC needs to shrink and focus on its central mission, tracking and helping to stop disease.
I think with monkeypox, there's no doubt that the agency, unfortunately, was reactive, not proactive.